Let's go ahead and code pathology case number 2 together as well, because this one's going to be slightly different than pathology case number 1. For pathology 1, we were working for the hospital, so our modifier reflected that when we coded the modifier TC for technical component. This time we're working for the pathologist. So right away I want you to make a note to yourself that when we code the modifier for the CPT code, it's going to be what? I'm going to ask you to think about it. It's not going to be the technical component. This time, we're coding the professional component. That modifier is 26. So right away, you might want to jot down somewhere, dash 26, just to remind yourself that at the end of this case, you want to make sure you add that modifier to the CPT code. So let's get started. We've got two specimens. We've got a right female breast mass and a left breast mole. And each of these specimens have their own diagnosis as well. Part A, the right breast mass was found to be infiltrating ductal carcinoma. And then we've got Part B, where the left breast mole was just a dermal fibrosis and edema. So let's get started. Our primary diagnosis here is going to be what? If you said carcinoma, you're correct. The neoplasms always take precedence when we are doing a pathology and there's a neoplasm that's discovered. We're going to go to the neoplasm table in your ICD-10 book. Instead of starting in that index, the alphabetic index, let's start in that neoplasm table. So let's do that now. So here you can see my neoplasm table, and you can see that I have highlighted and blocked off with my highlighter the main term breast and then all of the subterms that fall under that. This is so when I'm looking in my table, it's easy for me to see that these are all subterms here under the main term of breast. We also know that this first column is for primary malignancy, which is what she has. So let's start with C50.9. This pathology case does not specify which part of the breast it is, so we know we want to start with this unspecified code. Let's go there now. So here in C50.9, I see a 5th digit character signaling me that I can't code this just like it is. I need a 6th character. And this 6th character checkbox here is telling me you can't stop here. I've got to go one farther. Neither of these would be acceptable as final codes. So we're looking at malignant neoplasm of the breast of unspecified site, female, and the next code that we see is the right breast. So that last 6th character of 1 is telling us this is the right breast, and that's what our pathology report also indicates. So we know this is our final code for that primary diagnosis code, C50.911. Now let's find our secondary diagnosis code. Our second diagnosis was left breast mole. So let's go to the ICD-10 book in the alphabetic index and look for the term mole. When you find the term mole in your alphabetic index, look for the subterm skin. Under the subterm skin, you're going to see an instructional note that says C. nevus. So now we know that we've got to look up the main term nevus. Go ahead and do that now. So under nevus, you're going to look for the subterm skin, and then you see breast. The code listed there is D22.5. Let's find that in the tabular and see if we have any more information. So in the tabular, under D22.5, right here, you see melanocytic nevi of trunk. And then you see the code descriptors here. This is what this includes under trunk. And right at the bottom, you see melanocytic nevi of skin of breast. This is where your breast mole is going to fall under. So D22.5 is the code that we need to use for our secondary diagnosis code for this case. Now it's time to find the CPT codes. We've got our primary diagnosis code of C50.911. Our secondary ICD-10 is D22.5, and we need to find a primary CPT code. What do you think the primary CPT code is going to be? If you said that it's going to be the specimen that relates to the bright breast mass, you're correct. Because this is our primary diagnosis, our primary CPT code needs to match that. So let's go ahead and grab the CPT book and look for, in the index, you're going to look under Pathology and Laboratory. So here we find ourselves again at surgical pathology. This is where we found ourselves in case 1 of pathology. Like I said, you'll be using this section a lot when you're coding for the pathology reports, and this is why I have mine highlighted. You know that this is a gross and micro exam based on the pathology report. So we're going to start right here at 88302 and take that to our tabular in the CPT manual. Let's go ahead and find that now. And here we are again at 88307, just like we were with the first case, because we find that we have the breast, excision ablation, and requiring microscopic evaluation of surgical margins. In 88305, we also saw the term breast, and the difference is that it did not require a microscopic evaluation. So we're going to stick with our 88307 for this primary CPT code. And remember, what do we remember? Our modifier. We need to make sure that you don't forget to add that professional component modifier 26 because we're coding for the pathologist. Now for the secondary CPT code for the left breast mole, we're going to look again under the gross pathology specimens, gross and microscopic. We're looking under 88305 right now, and we see skin other than cyst, tag, debridement, or plastic repair. This would be where our mole would be described. So we're going to stick with 88305, the surgical pathology gross and microscopic exam for the left breast mole right here. So that's our secondary CPT code, and you did it. Don't forget, what are we supposed to add for that modifier? 26, you're right.